Concussion is the most common type of traumatic brain injury, or TBI, which results in chemical changes in the brain and sometimes stretching and damaging brain cells. A TBI occurs due to a bump, blow, or jolt to the head or by a hit to the body that causes the head and brain to move back and forth rapidly. The sudden movement can cause the brain to bounce around or twist within the skull. Concussions can affect both boys and girls. Football is the most common source for boys, and soccer and basketball is the most common for girls. Other sources include rugby, ice hockey, lacrosse, and any other contact sports. In athletes of all ages, a single concussion that goes undiagnosed can put a person at risk for brain damage and even disability. Having a single concussion can cause a greater risk of additional and more severe concussions. Therefore, individuals with any symptoms of concussion should be evaluated right away. Children need more rest than adults because their brains are still developing, while adult brains are fully developed. Children not only need physical rest but also cognitive rest that limits brain activity, such as through modifications in school until the individual is asymptomatic. Concussive injuries sustained early in life may have minimal effects on already established cognitive skills but may significantly delay development of future skills. The signs and symptoms of concussion fall into 4 categories: physical, cognitive, emotional, and sleep. These signs and symptoms are often similar to depression, anxiety, and attention deficit disorder. The most common symptoms are headache, dizziness, memory impairment, nausea, and imbalance. There are many difficulties diagnosing a concussion of a young athlete. This is because athletes, parents, and coaches may have a lack of knowledge about concussions, and symptoms may not appear until hours after the concussion. Young athletes may be afraid to come forward about their injuries due to the fear of activity restrictions as well as pressure from parents or coaches.
There are many common myths and misconceptions regarding concussions in youth athletes. Many people believe helmets and equipment will prevent concussion if the newest model is used. But in reality, no equipment can completely protect from concussion. Helmets, mouthguards, and other protective devices may lower the risk, but no equipment eliminates the risk of concussion. Many people think that an athlete needs to be hit on the head to sustain a concussion. But actually, concussions can occur with any movement or jostling of the head, as in whiplash injuries, which are front to back or rotational force side to side. Male and female athletes have the same chance of sustaining a concussion. Female athletes are actually more prone to concussions than their male counterparts. Possible explanations for this are that female athletes are more open to report concussion, and there are gender differences in anatomy and physiology. There are no long-term effects of concussion. Actually, a concussion that is not properly treated at the beginning can lead to post-concussion syndrome with prolonged symptoms that affect memory, physical, and emotional functioning for many months to years. In order for it to be a concussion, there has to be a complete loss of consciousness. This is false. Studies have shown that a majority of concussions actually occur without loss of consciousness. Approximately only 10% of concussions involve loss of consciousness. In order to best prepare yourself to manage athletes at risk for concussions, you must know your athlete, have baseline health and cognitive data, establish effective communication with the coaching staff, trainers, athletes, and families, be prepared to manage an acute injury, have appropriate sideline protocols, provide structured ongoing follow-up, as well as educate yourself.